Hi there, my name is Dr. Darrell Bossens of Barrie Chiropractic and Health Services Center, and today we're doing a video on how to use the Inversion inversion table. Now this video is meant to follow up an in-office discussion that we should have already had regarding you borrowing the inversion table, or perhaps you've bought your own to use at home. So this is supposed to help you understand how to use it, okay? Now if you're viewing this video for the first time and there hasn't been any discussion about whether or not you should be using an inversion table, really you should check with your healthcare practitioner before you use inversion therapy. Okay? So this is the Inversion inversion table that we get in Canada. There's basically two kinds of inversion tables. There's the ones that hang you from your feet, and there's this one. The advantage to this one is that it's basically going to hang you upside down from the pelvic piece here, so that your body weight is being distracted right where your lumbar spine is, which is where we want it. The other tables that hang you from your feet, a lot of the forces of your body are kind of being dissipated through your hips, your knees, and your feet before it gets up into your back. The other advantage of this one is that your spine's actually going to be in a little bit of flexion, which takes out some of that natural curve. It essentially unlocks the spine, if you will, and it makes it a little bit more receptive to a distraction, whereas the other type of inversion, your back is still straight, that spinal curve is locked in. It's not quite as easy to get the forces in there to distract the spine. Okay, so as you can see, this is the folded up version of the inversion table. So maybe you brought it out of your car from the office to borrow it, or maybe you brought it out from underneath your bed. So the first thing is to get it set up to your height. So this thing opens up just like this into an A-frame. And the back of the table is right here where this padded bar is. So what you're going to do is you're going to step inside the table from the back, from the padded bar. As you move into this pelvic piece, it's going to rotate just like that. The objective is to get the top of that pad level with the two hip bones here. So I'm going to open this up a little bit. For me, in my case, that should be about where I want it. Once you get it about where you want it, you're going to lift the bar up here and figure out which hole aligns with the receiver on the other end. So in my case, it's the third hole. So I've already removed these knob screws from the machine just to make this a little bit quicker. So you're going to insert these back in here. So in my case, it's the third hole. And this doesn't have to be super tight, just snug. You don't want to over tighten these things. And that will help lock the table in so it's nice and safe. You'll do the same on the other side. And while I'm screwing this in on this side, when you go down on the table for the first time, obviously blood's going to kind of flow to your head because gravity works, and you're going to feel a fair amount of pressure. It's uncomfortable, so you don't want to stay down there for very long. Usually that happens within the first 15 seconds or so. So once you get down there and you start kind of feeling that, you're going to come back up again, give your body a chance to recover. It usually takes 15 to 30 seconds, and then you go back down again. If it happens again, that being the pressure in your head, come back up, wait for 15 to 30 seconds to recover, go back down again. Usually things will be pretty good by then. What's happening basically is you're giving your body a chance for the valves in your veins to close so that the blood doesn't flow up into your head. Okay? So here we go. What you're going to do is you're going to walk into the table, the cushion engages like that. You're going to use your hands to transfer your weight from your feet onto the pelvic piece. So you're basically going to walk your hands down the machine like this as I'm now transferring my weight onto my pelvis. At this point, I'm off my feet, I'm just on my pelvis, and I'm going upside down. Right about at that point, people can sometimes feel a bit uncomfortable because they feel like they're going to fall forward. But what's going to happen is that this bar is going to lift up and grab the back of your legs and basically lock your legs at the pelvis into that pelvic piece. And now I'm hanging from my lower back. Okay? So as I start to feel that pressure, I'm going to come back up again. Now when you come up, we don't want you to go into extension like this. We don't want you to rotate or move around. The idea of this is you just sort of hang out statically and let gravity do its work. So when you come up, you're going to use your hands on the floor. You're going to work yourself up and then onto the table and then all the way back up again. When you get to about this point, rather than pop up and maybe get a head rush, I want you to just kind of hang out there for a few seconds so that you can recover, just to avoid you feeling kind of woozy or dizzy, and then come back up. Alright, so as far as how long should you be down there for, after you go through the first 2 or 3 warm-ups, so to speak, so that you don't get the pressure in your head, You're going to want to stay down for anywhere from 30 seconds to 3 minutes for the first few times that you do this. If you're comfortable with inversion, you can work your way up to anywhere from 5 to even 15 minutes, but I wouldn't go over 15 minutes. Generally, people are in that 3 to 5 minute mark. Some people can get up to 10 minutes. It's basically whatever is comfortable for you. The idea is that when you get upside down, you want to try to relax your body so that the muscles in your spine aren't guarding and protecting things from happening. If you're guarding for too long, you can actually cause those muscles to go in spasm and it can be uncomfortable. So you're better to go a little bit at a time frequently rather than a whole lot of time all at once. Okay? So if there's any questions, please make sure you contact us at the office. The number is 705-792-6690. Good luck with the inversion table. I think it's a pretty helpful thing to be able to do. We'll see you soon.